Now that winter is over, are you a golfer or tennis player trying to get back into the swing of things? Maybe you're noticing some forearm or wrist pain that just won't seem to go away. In this video, we're going to talk about radial tunnel syndrome and how that might be keeping you from shooting your best shot. To fully understand radial tunnel syndrome, it will be helpful to give you an outline of some of the relevant anatomy. We're going to start big here just to get your reference, and we're going to zoom in on the forearm and elbow area. Now, this is our blown up view of the forearm and elbow here. This is the elbow joint, and the radial nerve has been highlighted in blue there, and it has branches that come down the forearm and into the wrist. And as the name implies, radial tunnel syndrome involves the radial nerve, and it is the pinching or irritation of the radial nerve, usually by some of the forearm muscles here through repetitive movement. And the most common muscle involved here is the supinator. So I am tracing it around there, and that muscle involves turning of the palm up. So palm towards the ceiling, that would be this muscle right there. People at risk for radial tunnel syndrome are occupations who involve a lot of repetitive wrist motions, so electricians are a big one here. And then you would also find issues with the supinator in some repetitive sports like tennis or golf. Symptoms of radial tunnel syndrome can include anything from numbness, tingling, or weakness to pain in this area from about the elbow, most commonly, down the back of the forearm and into the hand and wrist. So that'd be anywhere from about here and all the way down into the forearm and wrist. It is also very common for people with radial tunnel syndrome to have pain at night, whereas a differential diagnosis for this condition would be lateral epicondylitis or epicondylopathy, which is tennis elbow. It is common for people suffering from radial tunnel syndrome to have pain at night or to wake up in the morning with an increase in pain. And that is different from tennis elbow, which is also pain on the outside of the elbow, where people suffering from tennis elbow do not usually have pain at night. So good thing to keep in mind if you are having any sort of wrist or forearm or elbow pain.